state hospital should be. Basically, so the state hospitals, when your client goes to a state hospital, you should have regular communication with the hospital. You should have at least once a month communication with the treatment of your client or the competency to restoration and how they're doing. Now, the hospitals differ regarding communication styles, right? Florida State Hospital has desk files. I don't know if you guys know about that. It's an electronic medical record that you can go in and have access to, desk files. So you're able to get information that way, and actually, are you able to write in it? I don't think so. No, I don't think so. But it's important to have communication because sometimes the hospitals will get people from the community and they really don't know anything about that person other than the evaluations that are in the packet. And a lot of times clients that end up in the state hospital maybe have well-established cases at the provider agency. So you as providers might know more about the client than the state hospital staff do. And so you need to tell them what's going on. There was a couple cases that I was working on that on paper, you really couldn't tell what was going on. And from what I knew, the case, it wasn't so serious, but the news about the case was serious. Like News Channel 20. And it involved, the sheriff's wife was at the, you know what I mean? So that kind of thing that the state hospital maybe needs to know, or that the client has been in and out of services, that the state hospital needs to know what services worked, what didn't work, what might be the best treatment for that client. All right. You need to work with the state hospital on input for the conditional lease order. And also, you need to make sure that you provide information on what you think would work regarding the client's release from state hospital, where they should live. So I often get asked, who's responsible for finding a place, right? It should be both. The community, forensic specialists, and the state hospital treatment team. So a lot of times I find it either one or the other. Some of the state hospital team is really good about finding places. Some of the providers are finding places. Some of the complaints I get from state hospital are that the community case managers are not involved at all. Some of the complaints I get from the community case managers, there's no communication from the state hospital. So I think there's a combination of things that could happen for a better outcome. But, so having input, having that regular communication. I know it's hard attending the treatment teams. I found it to be very cumbersome to try to attend the treatment teams at the state hospital. So hopefully there can be a better system, but I'm not sure what the answer is. Quarterly visits. You have to go to the state hospital and see your clients face-to-face on a quarterly basis for forensic. Okay? So when you go to state hospital, what should you do with a client when you see them? Meet with them, yeah.
Go through their chart, see how they're doing.
Go through their chart, see how they're doing.
Talk to the ward staff.
Talk to the ward staff.
See where they are, their charges, and
See how they're doing. If they're there for competency, how they're doing in competency. So I remember a couple cases, and we found, I found this to be true on a lot of the cases where the clients, they were laying in bed all day. Bring it up with staff. What are you guys doing to incentivize them getting up and going to competency class? Because I had a couple of females that just laid in bed like for years and didn't become competent. So address those kind of issues with staff. You know, see what kind of things you guys can work out to see if get the clients to go to class, participate in class, bring up issues like if they're, if they don't go to class for a certain amount of time, they drop them out of the class, which is not good if they're there for competency and they're dropped out of the competency class. So work with the state hospital on that kind of thing. The folks that are still state hospital criteria that end their 5-year ITP, you want to work with the local CSUs. So the deal is they have to, if the provider, state hospital wants them back in the state hospital on a civil commitment, they have to be Baker active to the CSU and start the process for civil commitment. So it's a lot of provider work to get that done. So just keep that in mind. Now that, those cases definitely get Lauren involved. She will probably be able to help you, but definitely get us involved. Okay. Transition. So when you try to find places for folks in the community, you want to make sure that you know about the places. I would encourage you, if you can, to visit those places, like going to Day Springs, going to Appalachian Center, to see what their structure is and see if the client would fit in with that place. Plus, it gives you information, like all the information we got from Doug was great because we can tell that to the client. This is what's expected of you. This is what Day Springs wants, and you have to do these things to live at Day Springs, right? These are their rules. So it's important to know all those things. Okay. That's the end of this one. I wanted to cover, I know it's about 2:45. I have another whole training, but I won't give it to you. I'm gonna actually go through the sequential intercept model. Raise your hand if you've heard of that. I know you have. Okay. So the sequential intercept model is a model that we use